Get ready. Helena Hustle is now live. Here, we will showcase successful leaders in business, athletics, healthcare, and all things that make Helena a great place to live. Join Dr. Daniel Bridge, owner of Endurance Chiropractic, as he searches out amazing individuals who are making a tremendous difference in this place we call home. So sit back, relax, and get ready to be inspired with the Helena Hustle podcast.
Good morning, everybody. Welcome to Helena Hustle. I'm excited to have a conversation here with Dr. Kyle Moore. He's a medical doctor at St. Pete's. Dr. Moore, welcome.
Thank you. Thanks for having me.
Absolutely. We've talked about doing this for a while, so I'm glad we could find a time to sit down and dig into everything.
Absolutely.
Okay. Let's see if you can stump me, Kyle, with your two truths and a lie.
I've been stressing over this. So we'll see what I have. So.
I feel like I'm batting like 75%. Somebody could double check me on this, but we'll see.
Yeah. So here are my two truths and a lie. Number one, I'm known for being very good at remembering birthdays. Number two, my favorite medical procedure and the one that I'm best at is circumcisions. And number three, the first and only Spartan race I've ever ran, I took first place.
Ooh. Oh, man. These aren't easy. I'm going to say that number two is the lie.
That is true, actually.
It's a truth.
That's
okay.
True. What's unique about that, though, is I say that circumcisions are my best, my favorite, and that is true. I just don't have the opportunity to do them anymore.
That's why I'm like, you don't do circumcisions,
yeah,
but you would be good at it.
Yeah.
Okay.
Yeah.
What makes for a good circumcision?
A lot of attention to detail,
Uh-huh.
and there's a protocol that you follow, and if you do it the right way in a very slow, measured way, then I think that you usually have a really good outcome.
Okay. So what was you're killing my statistics here. What was the lie?
The lie is that I have never ran a Spartan race.
No. Okay.
Yeah.
Thinking about it?
I've thought about it, but I'm a little uncertain. I do some trail running and I enjoy that. And I have done some competitive endurance races in the past, but I'm not particularly fast. I do it more for pleasure. And so we'll see, maybe someday, but no, I've never even done one.
I haven't run in, I love to run, and that's been a big part of my life is, getting in shape and doing some races. And then, like I did the Governor's Cup Marathon a few years ago, but I haven't run in probably a couple of years. And I had a dream last night that I ran, and I was so slow. I have this mountain bike race this summer that I'm training for, a big 50 miler, which is in Butte, and I'm nervous. So anyways, something in my mind is telling me to get going, but let's just Spartan race sometime.
Oh, we should do it.
I think they do something around here.
I don't know. I haven't even looked up to see all the details about it. My brother-in-law has done one, and he's kind of encouraged me, so we'll see.
Okay. Just from what I know of you, the birth date thing didn't shock me, so I figured you're pretty good at that.
Yeah, that's one thing that I'm kind of known for with my friends and family. If it wasn't for calendars, pen and paper, and Facebook, I think I could make a living off of remembering birthdays.
Is it something that you have to work at, or this is just
it's just always come to me? Yeah, I think growing up, birthdays were really celebrated in my family, and were really important. So for me, it's one of my love languages, I guess.
Nice. What would you guys do for birthdays?
Oh, I mean, it would turn into a birthday week.
Oh, nice.
You got to pick the meals. You didn't have to do as many chores. It was just a really special day. Everyone was kind of expected to really praise you and serve you and everything else. And so we kind of loved birthdays around our family.
Well, June 27th, just so you know, that's mine.
Okay, I got to make an association. I'm getting a little bit weaker as I get older, so I have to really lock it in. So, okay.
Well, I'm trying to get on the good list.
I'm in there now.
Yeah, no, Crystal, my wife, is also, she goes all out on birthdays, and it's been a blessing for my family, my parents, and our siblings, because she's always trying to make sure people get remembered and have fun there. So well, good. So you grew up where?
I grew up in Idaho Falls, Idaho.
Okay. And so that's not too far. Is that 4 hours from here?
It is. It's about a 4-hour drive south. And my wife grew up 4 hours north of here.
Oh, right.
In Raymond, Alberta, Canada.
Which is where my dad's grew up.
That's right. Yeah. And so that's how we ended up in Helena, honestly, is we were looking for a job out of my training, and we wanted to be closer to family than we had been in the past, and didn't know exactly where we wanted to be. And this was the midway point. And so we found a job here that worked out perfectly.
Fantastic. Let's go back a bit. So what brought you on this path to become a medical doctor?
Yeah, it's something I've thought about a lot of my life, you know,
Mm-hmm.
looking back, I found like a little journal I had when I was in elementary school. What do you want to be when you grow
Really?
up? And,
Uh-huh.
and I said I wanted to be a doctor. And I think I grew up in a family where my father worked for a bread company
Mhm.
and worked tremendously long and hard hours
Mhm.
and was the best dad you could ever ask for. You know, even after work, he'd come home and he'd help us with our sporting events. And my mom stayed at home with us most of the time growing up. She worked part-time at a dental office, and they worked really hard, and they really stressed education for the 3 kids. And I think with that emphasis on education and then seeing some examples in my community and some other aspects, just being drawn to science and the human body and the combination of science with communication, with so many different aspects of skill sets, I was drawn to it, and it was a good decision for me. It's been something that I've enjoyed doing.
Had you considered other careers, or was that pretty much it?
No, absolutely. In fact, as an undergraduate student, I would say maybe 90% of people have a major in biology or biochemistry because you have to take so many of those courses to qualify for medical school. I decided if I wasn't going to be a doctor, I didn't want to do anything in that realm. And so I was a communication major in college. So I took a lot of marketing classes and a lot of advertising classes. So I thought really heavily about that, about going into that field. I was a little bit discouraged about some of the stats about finding a job after graduation. And I thought about education as well and teaching, but ultimately I figured I could incorporate some of that education into my job as a doctor.
And your specialty is what?
So I have 2 specialties actually. So I did training as a family medicine doctor. So I did a residency geared towards that and board certified as a family med doctor. So just like any other family medicine doctor, I can take care of most general conditions. So whether it's, you know, depression or heart disease or lung disease or, you know, skin problems, I can look at all of those and make an appropriate diagnosis or referral. But then after I did some of my training, I was really drawn to substance use disorders and addiction medicine. And so I decided to get a board certification as an addiction medicine doctor. So at my role here in Helena at St. Peter's, I do both. I have half of my time is kind of dedicated towards family medicine.
Okay.
And then the other half is exclusively for addiction medicine.
Okay. Now, if you couldn't do your current specialty, what, but you were still a medical doctor, what would you do? What other specialty?
That's a great question. I think everyone in medicine likes to rib other specialties about who's the best and the best parts of their job and the worst parts. And truly, I believe that there's good parts and bad parts to every specialty. So it'd be a tough decision. One that's kind of intrigued me a little bit is urology. I used to never want to be a surgeon, but urology is kind of unique in that you get a mixture of doing some procedures and surgeries with a lot of outpatient work. And I kind of like the urogenital system, so that'd be interesting.
Nice. Okay, Kyle. So you've been at your current job for how long?
I've been here 3.5 years.
Okay. And without breaking HIPAA, are there any, really interesting or unique cases that you could talk about?
Oh, there'd be too many to think
Too many,
about.
yeah.
I've had some patients where they have been diagnosed with disease states that you just don't learn about in medical school because there's so many different possibilities of things you can learn about. And so I have one patient right now who has a combination of a few different diseases where they've kind of given it its own name, and she's been studied at the National Institute for Health in Washington, D.C. And so the complexity of her care is overwhelming, and I feel really lost at times, but she is one of my favorite patients because she has an incredible memory and a skill set in being able to organize her healthcare, and she has incredible expectations about the limitations of what we're able to do, and she has incredible appreciation for the little things that we can do to help her. And she's lived a pretty good life considering some of the challenges that she's had. And so it's really inspiring to me to see her and some of the things that she's overcome with this tremendous health problem.
Wow. Yeah. What would you say are some common misconceptions or things that you wish the general public better understood when it comes to substance addictions?
Oh, it's my favorite thing to talk about.
Is it?
I'm glad you asked this. Yeah, it's like I almost enjoy this better than the care itself, is kind of advocating for this because I think that there are so many misconceptions. One of the more common ones is I think a number of years ago, the perception about addiction is that it's a moral failing, that it's a character defect. It's
Lack of willpower.
It's a lack of willpower, lack of motivation, and that if you just had the right motivation, you could overcome it. And that was based upon what we see.
Right.
And when we interact with people who have addiction. But fortunately, we have new medical technologies that allow us to understand it a little bit better. So principally, we have things like functional MRI. So you can take markers that show up on a brain scan, and you can see what activities of the brain, what areas of the brain are lighting up with activity. So just like if you were to look at, well, what parts of the brain light up when someone moves their bicep muscle? You can do the same thing with other areas of the brain. And so with addiction, there are centers of the brain that change depending on what chemical someone has been using. And so we can see that there are some physical structural changes in the brain that are present with people with addiction and not with people who do not have addiction. And those can get better and they change. And so just like any other disease state, it's based upon structure and function. So the example I use commonly is type 2 diabetes. Most of us, if not all of us, either have type 2 diabetes or know someone very intimately who has type 2 diabetes. So that's a disease where a certain cell in the pancreas called the beta islet cells are affected. You can't secrete as much insulin, and then the insulin receptors don't work as well to bring the insulin into the body. So your body can't utilize, or they can't bring the sugar into the body. So you can't, it's a disease of not using sugar properly and having too much. And people can relate to that and they can understand that.
Right.
With addiction, again, we can see the same thing. But instead of the pancreas and the insulin receptors, it's the ventral tegmental area. It's the nucleus accumbens. It's these areas of the brain that aren't working the same. It's changes in how dopamine is synthesized. And once you understand that, I think it changes your perception on addiction.
Right.
Then you understand, oh yeah, this is disease. And because of that, we should treat it like a disease. So we should target it not only with behavioral techniques, but with medications. And that's what I'm passionate about.
You just reminded me, there's a comedian named Mitch Hedberg, and he says, alcoholism is the only disease that you can get mad at somebody for having. You never say, dang it, Marge, you've got lupus. But anyways.
Absolutely.
So with the neuroplasticity of the brain, the changeability of the brain, how long before you could maybe do a functional MRI and see changes in somebody?
Yeah, you start to see changes pretty quickly. I mean, it's gradual, just like anything else. Like if you were looking at someone's broken wrist, you start to see some changes over weeks to months. And that's what we see in addiction too, is within a couple of months, you can start to see some changes in a positive aspect. But it really isn't until over a year when you start to see more normalization of those images.
Do you deal with non-substance abuse addictions?
I do. It's not as common, and there aren't as many FDA-approved medications. Really, there are no FDA-approved medications for behavioral addictions, but we absolutely do. There's a similar neural pathway and what's involved in that. And so whether that's gambling or sex or any other
weight loss.
Weight loss is unique because there's so many other things involved in that.
I guess I should say food addiction.
Food, yeah.
Is that?
It's something that definitely, we see and plays into a lot of things. I don't usually treat that as much, mostly because there are other specialists who are better than me at that I usually refer people to.
So take gambling. Is there medicine for that, or is it more behavioral therapy?
Both. So there's a lot of behavioral therapy, and there are medications that can help and do help. Again, they're not FDA approved, but they're safe and effective in studies. And so we feel comfortable using them.
Wow. Okay. I didn't know that.
Yeah.
In 10 years, what advancements would you like to see made in medicine?
One of the biggest ones is better treatments for stimulant use disorders. So right now we have pretty good medications for alcohol and for opioids and for tobacco, but we don't have very much for stimulants. So methamphetamine, cocaine, prescription stimulants like Adderall. So when people become addicted to those, it's harder to use medications to get off. And so I'm hopeful that there'll be new technologies that we can use medications to assist in the other aspects of helping people come off of those.
So talking about Adderall, how addictive, because that's essentially a pharmaceutical grade amphetamine, right?
Yeah, absolutely.
How addictive is that compared to, let's just say, like meth?
It depends on the person, and I don't know the exact data as far as, to be able to say, well, it's going to be this or that. People will ask me commonly, what's the most addicting substance? And the answer is whichever one you're addicted to.
Right.
You know, it depends. Everyone's biochemistry is a little bit different, their genetics and what they've been exposed to. So compared to, you know, it's not as rewarding as methamphetamine, meaning it doesn't have the same dopamine surge and it doesn't have the intensity. So things that act quickly and have a really powerful effect are generally going to be more addicting. And so Adderall is much less addicting than methamphetamine. So as you know, many people benefit from Adderall, and it can be a life-changing medication. But because it does have a chemical property similar, it can, in some people, it can be problematic. So
I see.
Yeah.
Right on. How is AI being used now? And kind of like my previous question, in 10 years, what role do you see that having in the medical field?
Well, my greatest hope is that it will reduce paperwork
Yeah.
and the administrative role, really.
Yeah.
Because, and I'm sure you encounter this in your job too, is I think anyone in healthcare would say that their favorite part of the job is patient care, being able to help people, and their least favorite job is paperwork.
Right.
And it's a misconception that people have about healthcare in general. I think that the amount of time that is spent on paperwork. So for my job, well over 50% of my job is spent in paperwork.
Wow.
And so sometimes I'll have patients who are like, well, I just have a couple of questions, and it's true. And I, try to help, but the amount of time that goes into documenting those questions, prescribing the medications, filling out the forms that they need for X, Y, or Z takes a lot of time. So I'm optimistic that with AI, there will be opportunities. For example, AI could listen to a conversation that you have with the patient and then formulate your note based upon that conversation. And you don't have to go and do a note. And then there's a medical record of what you discussed and what the plan was, what the risks and benefits were, and you're done. And that would be ideal. That would take away a lot of stress and be a time saver and really improve satisfaction among providers, I think.
I have to imagine that that's not too far away.
Well, they actually are doing that already in some places, but I think it's, it's a very new technology and it's imperfect, obviously. And, something like this won't hit Helena for quite some time.
Well, and it's so important, like a self-driving car, like it can't work 90% of the time. It's got to be pretty dang near perfect.
Absolutely.
To replace that. But yeah, that would be nice.
Oh, it would just be amazing.
Do you guys ever use like scribes, have somebody come in there and help you with notes while you're doing patient care?
Yeah, when I was in residency in the emergency department, that's a common place to have a scribe because you're going back and forth so quickly. And other specialties use scribes at times. Primary care, not as many people do. It's expensive. It's a big expense to have a scribe. And I've fortunately become a little bit faster. I have a microphone.
Oh,
and
heck yeah.
I think that's one of my maybe hidden skills too, is I'm very fast at dictating. I can speak incredibly quickly when I need to. So
you have a text to speech or a speech to text program.
Yeah. So I can, say there's a 32-year-old female here presenting with nausea, vomiting, and, and just really pound that out very quickly.
Nice.
And works pretty well.
Really cool. What would you say are some strengths of your clinic and things that you guys do really well?
Yeah, well, I work with Megan Zawacki. She's a physician assistant, and I'm the director of our addiction medicine clinic. So it's a small team. It's me and Megan as the providers, and we have a nurse, we have a nurse care manager, and we are going to be getting a licensed addiction counselor in the coming months.
Yeah.
So that's really exciting. And I think some of the strengths that we have is the quality of our people. I mean, we just have compassionate and talented and insightful and knowledgeable people. And then I think one thing I'm really proud of is that for the most part, well, not for the most part, is as much as we possibly can, we practice evidence-based medicine. And I'm really big on that. I think that you can get into a lot of trouble when you start to just guess and hope things work or say, well, the patient says that this works for them, or, their cousin used it and they saw it on YouTube. And I really try to base my medical decisions off of some degree of scientific evidence that's been, what would you say? I guess that's been reproduced and that's been on large scale studies. And so I don't like to just take anecdotal, well, I think this is going to work. I want to have more information of why I think this is going to work and have safe protocols, make sure people, number one, are not being harmed by any of the things that we do.
So somebody dealing with a substance abuse addiction or one of these other ones that we've discussed, and they're, wanting help, what's that process look like for them, from them being in their home and struggling with this to actually sitting down and getting the care that they need?
It's different for everyone. There's different avenues to find us. You know, some people, they may be talking with a specialist or their primary care provider, and it comes out like, hey, you know, I had that fall, broke my ankle, but I was intoxicated. And, you know, as I've been reflecting, I've had more alcohol use than I think is healthy for me. And so they may get a referral from another provider. For some people, it's through the legal system. You know, they get caught with drugs, and the judge or their probation officer asks them to come see us. And then for some people, they just hear about us and they make their own referral and they come in.
They can just go straight to
Absolutely.
you.
Yeah. And those ones work. I really enjoy those ones. I like, any avenue, but those are fun. And when they come in for their first time visit, we do a long consultation and make sure that we understand who they are as a person, their social support, what kind of drives them, their medical history, their psychiatric history, their substance use history, and then we create a plan based upon their goals. And I think another misunderstanding in addiction is that you have to be all in or all out.
Right.
And that's not necessarily the case. You know, some people, it's like, well, I want to reduce the amount of drugs I use, or I want to reduce the amount of alcohol I use. And we work with people with whatever their goal is.
And they can feel comfortable that, let's say they're using illegal drugs, that's just going to be between you and them.
Absolutely. Yeah. I don't like to play the role of a cop or a detective. You know, everything that we talk about is protected by law. And so it's always confidential. And it's something that is obviously, you know, when you're using a legal drug, it's a hard conversation to have for the vast majority of people. And I think that we create a pretty open environment where people can feel more comfortable talking about that.
Right.
And, you know, it's non-judgmental. We know that this is a disease and that people are trying to do their best, and we're just there to try to help them.
And what behaviors or strategies, how would I word that? For those that have the most success, what are things that they're doing on their own to fortify that?
Oh, that's a great question. One of my mentors used to say the opposite of addiction is not abstinence, but it's connection. And I think as I've matured over the years in my treatment of people with a substance use disorder, I believe that even more and more. Is that I find that the people who do the best are the people who connect in some way, whether that's with an old hobby, with a community, with whatever it may be, you know, but trying to do it just by saying I'm not going to do it and sitting at home doesn't work as well for people.
White knuckling it,
just sitting at home, Netflixing, you know, watching Netflix is not as good of a strategy. So people have strong opinions on everything from AA to church participation to intensive outpatient groups. And all of those things have some merit and some science backed to show why they might help. But I think the biggest reason they help is because they provide a community and they provide support.
Connection.
And connection.
Great. That's fantastic.
Yeah.
Dr. Moore, thank you so much for coming and sharing. I've learned way more than I expected to. So, I'm going to re-say that because that sounds weird. Dr. Moore, thank you so much for coming on the show. I learned so much today. If somebody wanted to learn more about your services or reach out to you, how do they find you? How do they get in touch with you?
The easiest way is to go to the St. Peter's website, sphealth.org, and you can find the contact information there. I'm bad. I don't have the phone number pulled up right now.
We'll put it in the notes.
I don't memorize that as much as I should. That's probably the easiest way.
sphealth.org.
sphealth.org, or calling the General St. Peter's number. Or you could ask your provider. I think a lot of providers in town know a little bit about our services and how to connect people with us.
Great. Well, I hope, you know, some people can find some great solutions for themselves.
We'd love that.